Hello, today I will be doing catheter insertion using a vagina anatomy. So I have maintained an order for the patient. There was over 300 milliliters of urine when we looked during the bladder scanner. So I'm just going to go check in on my client. Knock, knock. Hello, how are you?
First, I'll be touching only the inside of the glove for this one.
Okay, that's good. So I know that you're aware that we are inserting a catheter today.
These actually fit, so that's great.
Do you have any questions before I begin?
Like that. Now only grab the outside of this glove.
No. Oh, when we used the bladder scanner, there was over 300 milliliters of urine.
Touching the outside.
So the doctor wanted us to insert a catheter.
There's a little bit of.
Do you mind if you could tell me your name?
Pour it in, that's fine. And then this.
Can I see your wristband?
Down. So keep these above.
Perfect. Thank you so much, Susie.
And then I can get
So now I'm
into
going to
here.
set up my my field. Okay, so I'm going to sanitize my hands and my and then I would use a cavi wipe and clean my table. So I have my catheter bag, my Foley catheter, my Foley catheterization tray, an extra set of sterile gloves, and an extra blue pad for absorption. So I'm going to take my absorption pad. Okay, Susie. So what I want you to do is spread your legs open like a frog for me. Okay? I'm just going to raise the bed up.
These are still sterile. They've only been touched with sterile gloves. Place them back in the field.
We want everything at hip level. Okay. Oh, and before I begin anything, I would provide Susie with pericare. I'm just gonna put this underneath your legs, like so. I'm just gonna raise the bed a little more.
Yeah, the versus tray, so it's less susceptible. So this is a
Keep
tray.
hand hygiene. Gonna take out my catheter bag.
I'm gonna lube 20 centimeters.
Preparing it for
Got a male here.
after
minimum
I put
20
her
centimeters.
catheter in.
More lube here.
Okay, let me put that here, not here, not here. Okay, it is with an expiry date. It is completely sealed. And hand hygiene, I would have. Just gonna roll this up and create a little garbage can, like so.
So that almost went out of the field a bit when I grabbed it.
Hand hygiene,
That's not
okay.
ideal.
Okay, Susie, I'm going to start now. You're
As much
comfortable?
sterile as possible.
Okay.
Total stability. Nice to have with this. Keep patient hears or reflexes, but you want to have the bed positioned in a way that is a little bit upright.
I have my sterile gloves here.
Have their legs slightly bit apart, and just make sure they're comfortable.
My supplies. I'm just gonna put this on my 1-inch border while I take off the packaging for my catheter.
Okay, so before we do any iodine, we'll get this
I am
position.
tearing off the package away from my sterile field. Sterile.
And that's going to be ready to go there.
And then using my tweezers, I can grab the blue and
So now
gently
you would-
place it.
These are the iodines on the stick. And so we grab these, open them up in the field.
Okay. I'm going to use these sterile gloves today.
At the last possible moment. You compromise the sterility of the left glove here. Pull back the foreskin.
Got my
These
package.
should be
My
ready to
hands
go.
have been sanitized.
I won't touch this package after touching the patient, but it will be opened up, and I won't get a mess here. But we would be using one swab or one stick for one stroke at a time.
Using
Make
my
sure full coverage
non-dominant
of the
hand,
penis and
grabbing
iodine
the right glove on the outer cuff.
promote full asepsis. And we dispose of that if possible, so the fully iodine penis will be ready to go. I'm never gonna compromise sterility by touching any of the field
Like
with
so.
the left hand.
Now I'm taking my dominant hand and I'm scooping
get
up
the
the
patient
left
to-
glove underneath.
Breathe in. I might need a little more lube again, kind of dried out. And so I will push the penis down.
And then I can
perpendicular to the body.
roll up my
And
gloves.
I'll get the patient to just
Then I can discard this
breathe in and let me know if there's any
and take
discomfort.
this.
And I'm going to not just raise the penis there with this. That wouldn't be best practice. You want to
Okay,
not
Susie,
touch
I'm
the
just
penis
going
at
to
all.
put this little drape underneath your
With
legs,
the right
okay?
hand, you just
So I'm
make sure
folding it
you get at least 20
like
centimeters
this.
in,
like this.
and
So I maintain
Going.
sterility.
for at least 20 centimeters or until you see the urinary output.
And then I have the blue drape here. And it's going to go over
Put this in. You need to
her private
keep
parts.
pushing this down while I'm doing it and
Oh.
not touching the penis with.
I did that
So
wrong.
just
I
slipping
didn't
up.
do the fold thing. But
So if
I
I
didn't
see
make contact
urinary
with the model's skin at all. I just
That's
gently
good.
place it on there. And then I went like
Before,
this
I'm just
to
gonna
maintain
stay looking at the
sterility.
patient's face to assess if any discomfort.
Okay.
Put this in a little
So now
bit
I
and
can
ask
touch
them
anything
if
in
they
my sterile
feel any
field.
discomfort.
So I got her
Make sure
catheter
that
here.
We're not filling the urethra. Would be no good.
I got
Proceed
this.
with
I don't need
continuing
it.
to blow up the balloon.
I don't need this. Got the gel, the sterile water, and the
Take this.
iodine swabs.
Only touch this section just to make sure we can get it off properly.
Take
There's some urine output.
the plastic off like so.
Some more urine output. And so we'll want to be attaching the catheter bag soon, but first we'll
You can push
pull
it
out
up
a
a little
bit
to get the
we
air
wanna
out
use that hand
if
to
you
do that.
want.
But we'll pull out a bit with this to make sure we get some resistance, and there it is. So we're confirmed to be in there. And then we're gonna push that back in. Also, we don't want to
I would have restarted everything. Cause yeah, I would have just restarted.
I'll swipe that
But for
there.
this video and this demonstration,
based
I
on
won't
the
gather new
patient's
materials just
Comfort
because
or
it would be
preference, we'd
wasteful.
Get a patch, or maybe just a strap to
And
attach
this one open.
the hose on. We'd also cut it to length based on their preference as well, whether or not they like to sleep with it or hang it over the bed when they sleep or what have you. And also before all that, this reminds me that if we were asked to get a sample,
There we go.
CNS sample, then I would have done that after.
Okay, I am lubricating 10
centimeters.
centimeters.
And yes, we'll make sure that they're feeling okay. And
Keep tearing my iodine. Okay, and then I'm bringing my tray over to Susie.
All this with the gloves
Okay,
on.
so once I'm here,
Clean this
I would,
stuff up.
there's 3
We will rip this.
Q-tips with iodine in here. So, using my non-dominant hand that will soon be non-sterile, I will spread the labia. Or before I do that, I swipe
So after
down.
I clean up,
discard,
take off.
swipe away from me, discard,
Sure to
and then swipe towards me and discard.
How the patient responded to the procedure, if they were
I'm opening
discomforted
up
or
her
uncomfortable or anything.
labia.
Document the urinary output, and if there's anything abnormal.
And I'm going,
Nether
since
regions
this
down there.
has female anatomy, I am going to ask the patient to cough so I can have a better chance of seeing where I need to insert. Okay, Susie, cough for me. Okay, are you ready? And I am advancing. Advancing. I have urine output. So I'm going to hold the catheter and I'm going to insert the water for the balloon. Okay. Okay, I should not have detached the syringe with my non-dominant hand. And I'm gently pulling it back. And then I would attach the catheter bag, and I can get a new pair of gloves for that. So I'm going to go this, this, and this, wash my hands, and then put a new pair of gloves on. Put a new pair of gloves on. And when I take this blue cap off, it is sterile still. And also checking in on my client and asking them if they feel any pain or if they're doing all right, how are they, etc. And that is it. And then I would chart that I inserted a catheter on Susie, the size of the catheter I used, how she tolerated it, and then see if there is, like, track the urine output like every hour or so, and that's it. And then cleaning up your sterile field, and then lowering the bed down to knee level, putting the call bell in reach, asking if they need anything before I go, and etc.